Welcome to the Essence of Health Tea Time Podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. Excited to announce that my metabolic coaching program has started and is waiting for you to come and join me. Within this 12-week program, we'll work together one-on-one to not only develop your personalized plan to improve your condition of insulin resistance, lower your blood sugar, lose weight, re-energize your body, and keep you feeling your best self, but will also get you off of that fat diet hamster wheel for good by giving you a sustainable plan that actually works within your busy schedule to keep you in good health. Head on over to drshayla.com/EOH to book your free strategy session with me, and let's get started today. It's tea time. In the month of February, we highlight heart health awareness, and this is totally necessary due to the fact that heart disease still reigns supreme as the #1 cause of death in the United States. A 2023 poll showed that more than half of American adults were unaware that heart disease is the leading cause of death in this country, despite the fact that this has remained true for over 100 years. So if you're listening, I'm glad that you're joining me today to get this tea on heart health. Now, if you're new to the Essence of Health Tea Time podcast, I'm going to recommend you go back and listen to our other heart healthy episodes, particularly episode number 20 for the tea on stress and self-care, and episode number 21 for some heart healthy food facts and the tea on soy in your heart. On today's episode, I'll be spilling the tea on 5 lesser known factors that may be impacting your heart. The American Heart Association, or AHA's, goal for 2024 is to make an impact on the health of all Americans. Their 2024 health equity goal states, every person deserves the opportunity for a full, healthy life. As champions for health equity, by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality. Now, we know to achieve this goal, it will take many of us, including healthcare providers, patients, families, politicians, all of us to play our part in advancing health equity so that everyone truly does have the opportunity for a full and healthy life. So listener, while you're getting the tea here today, do your fair share and share this wealth of knowledge with others, your family, your friends, your community, so that we can all do our part in improving the healthcare, health literacy, and health impact of one another. Now, get this tea on those lesser known factors that may be impacting your heart. Number 1, your oral health and hygiene. When was the last time you saw your dentist or dental hygienist for an oral checkup? The Centers for Disease Control and Prevention, or CDC, reports that over 26% of adults in the United States have untreated tooth decay. And while we're discussing health equity, the CDC report goes on to say that adults who are low income, have less than a high school education, non-Hispanic, Black, and current smokers are 2 times more likely to have untreated cavities than those other comparison groups. This same report reveals further that nearly half, 46% of all adults aged 30 years or older, show signs of gum disease. So you may be wondering, Doc, why are you talking about teeth? I thought this was a tea about heart disease. Well, listen up. Poor oral health, tooth decay, and gum disease have been linked to one having an increased risk of heart disease. The AHA reports that studies have shown that periodontal disease, which affects 2 in 5 adults, may cause a 19% increase in the risk of cardiovascular disease. And as we age, that risk increases to 44% in those aged 65 and over. This is due to the level of bacteria produced when one has poor oral hygiene. This bacteria can enter the bloodstream, causing an inflammatory process within the blood vessels, leading to elevated blood pressure, clogging plaques within the blood vessels, and heart disease. But you can take action and fight heart disease with these few simple steps to improve your oral health. Step one, brush your teeth with toothpaste at least twice a day and floss your teeth at least once a day to prevent bacteria buildup. Step two, limit your intake of processed foods, particularly processed carbohydrates, that can increase your risk for tooth decay. Step three, see your dentist routinely at least once a year for an oral checkup and professional teeth cleaning. Now, let's move along to our next lesser known factors that may be impacting your heart. Number two, social isolation. Let's face it, we're better together as a society. The COVID pandemic certainly taught us that social isolation can impact our mental health in a number of ways. However, our physical health is often overlooked regarding the need for social support. A 2022 study in the Journal of the American Heart Association revealed that social isolation and loneliness increases one's risk for heart disease and stroke by 30%. And when we factor in adults who have already been diagnosed with heart disease, those who had fewer than 3 social interactions per month have an even greater increased risk at 40% chance of having a recurrent stroke or heart attack. Some factors that contribute to these findings are typically those who are socially isolated or lonely were found to be less physically active, consume less fruits and vegetables, had a higher likelihood of nicotine use, and were found to be more sedentary. We know that certain populations are more vulnerable to loneliness and social isolation, including those with limited financial resources, underrepresented minorities, LGBTQ individuals, those with physical and mental disabilities, and those who may live in rural areas. If you, a family member, or friend particularly fall into one of these more vulnerable populations, please be mindful of gaining social support to not only improve your mental health, but also for improving your physical and heart health. This may look like joining a local community group, visiting your local YMCA or community center to participate in center events, attending a place of worship, or going to your local public library. Just remember to interact with others. If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting. You know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to eohcoaching.com to learn more. The essence of health is in you. The next lesser known factor that may be impacting your heart piggybacks off of factor number two. So factor number three, your relationship status. I know you're probably thinking, Dr. Shayla, you just told us to go be social, but you didn't mention that I had to go get into a whole new relationship. But hear me out here. Your relationship status and the quality of your relationship can influence your cardiovascular health. This is indeed a two-way street. Studies have linked being married or having a life partner to better health and lower rates of heart disease. However, marital stress has been shown to cause worsening cardiac outcomes. In 2022, the AHA reported a study which revealed participants who reported moderate or severe marital stress were 67% more likely to report chest pain and nearly 50% more likely to be readmitted to the hospital for any reason than their peers who reported mild to no marital stress. Those with severe stress levels scored lower in physical health and mental health. Participants reporting severe marital stress also scored lower in quality of life. So, on the one hand, it's important to have social interaction, and it can be heart healthy to have a life partner. However, on the other hand, if your relationship causes more stress and strife than good, it would do your heart more good to focus on happiness. Next up with this T on little known factors impacting your heart. Number four, air pollution. We have become a bit more mindful over the years of climate change and its impact on our environment and our respiratory health. However, exposure to air pollutants can increase your risk for heart disease, heart attacks, and strokes. Research from the Environmental Protection Agency, or EPA, has found that exposure to increased concentrations of fine particulate matter, particularly defined as less than 2.5 micrometers, over a few hours to weeks can trigger cardiovascular disease related heart attacks and death. The EPA report goes on to state that longer term exposure can lead to increased risk of death from heart disease and overall decreases in life expectancy. So you may be wondering what type of air pollution exposure fits this criteria mentioned by the EPA that's harmful to your heart. Some sources of fine particulate matter, less than 2.5 micrometers, are found on construction sites, unpaved roads or fields, smokestacks, or fires. Even waiting in rush hour traffic in an urban area can increase your risk to this exposure. It's particularly important to do your part in taking care of our environment and being mindful of routinely replacing your car and home air filters to reduce your exposure to these pollutants. This brings us to our last little known factor that may be impacting your heart. Factor number five, temperature extremes. Both extreme heat and cold can strain the cardiovascular system. Heat waves can increase the risk of heat related illnesses and exacerbate underlying heart conditions, while cold temperatures can constrict the blood vessels and raise your blood pressure. We just discussed air pollutants, climate change, and its effects on our heart, but this is just another layer to that. In 2023, the National Institutes of Health, or NIH, published a study revealing that cardiovascular related deaths due to extreme heat are expected to increase between the year 2036 and 2065 in the United States. Furthermore, they predict that adults ages 65 and older and Black adults will likely be disproportionately affected. So, once again, this touches on that health equity aspect. Studies have shown that on days when the outdoor temperature is at or above 83 to 98 degrees Fahrenheit, the risk of a fatal heart attack was 18% higher. When temperatures were at or above 95 to 110 degrees Fahrenheit, the risk of fatal heart attack was 74% higher. And when it comes to cold weather, studies have shown that on days when the outdoor temperature was at or below 27 to 37 degrees Fahrenheit, the risk of fatal heart attack was 12% higher. These findings go on to show that women and individuals over the age of 80 years old are at the greatest risk when it comes to the impact of these extreme temperature changes. So, when it comes to your heart health, be mindful of the multiple factors that may be impacting your heart. Yes, you certainly want to eat lots of fruits and vegetables, routinely exercise if you're physically capable, get quality and sufficient sleep each night, avoid nicotine products, maintain a healthy weight, a healthy blood pressure, and lower your cholesterol. But as I have shared with this piping hot heart healthy tea today, you also want to maintain good oral health and hygiene. Make friends and get out more to commune with others. Maintain a long term healthy relationship. Avoid air pollution and protect yourself from extreme cold and heat to keep your heart healthy. I hope today's tea sparked something great within your heart today. If you found this episode helpful, enlightening, or encouraging, I invite you to share it with others and also leave a 5-star review. I always sincerely appreciate your support. Until next time, remember, the essence of health is in you. Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@EOHWC on TikTok. Interested in becoming a member of the Essence of Health Coaching Program? Well, head on over to www.eohcoaching.com. The essence of health is in you.